programang ito ay rated SPG. Striktong patnubay at gabay ng magulang ang kailangan. Maaaring may masiselang tema, lengguwahe, karahasan, sexual, horror o droga na hindi angkop sa mga bata.
Yan na! Yan na! Bumabanda, bilis, bilis! Sige, matatalo tayo!
Uy mga bebs, alis muna ako. May check-up kasi ako ngayon. Nag-text sa akin yung receptionist ko.
Samahan ka namin, gusto mo? Oo nga, magagabi na.
Ay, wag na. Hindi na kailangan. Saka ihatid sundo naman ako ng boyfriend ko, kaya wag na. Ang babait naman ng mga best friend ko.
Sana all new boy.
Sige, una na ako.
Bigyan mo na lang konti.
Eric! Eric! Akala ko ba ihatid mo ako?
Stay ka muna dito, babe, habang wala sila namin.
Ha? Baka malito ko niyan. Saglit lang ha. Wag! Wag, Eric! Eric, wag!
Huwag ka magawa, bubugbugin kita.
Good day po, ma'am. I'm April po, your nurse for today. I'll ask you sets of questions po for you to answer so that we will be able to assess your current state po. I will take down some notes po for every question po, but rest assured that all data gathered will be kept strictly confidential po. How are you today po, ma'am?
Medyo hindi po ako okay ngayon.
Can I ask your name po?
My name is Charlotte Calvario po.
Okay po. Where do you live po?
In Angeles City, Pampanga po.
Okay po. May I know when is your birthday?
November 5, 2002.
May I know your reasons or concerns po why you seek care in the hospital?
Ilang araw na po kasi masama ang pakiramdam ko. Parang lagi akong nilalagnat at pagod kasi masasakit ang aking mga muscle ko. Medyo hindi rin po okay ang itsura ng dumi ko. Bigla-bigla rin po akong pinagpapawisan kapag gabi na. Kanina ko lang po napansin na nagkakaroon rin ako ng puti-puti sa bibig at hindi na po siya natatanggal kahit mag-toothbrush pa man po ako.
Mga symptoms na nararamdaman mo po ba? When did it start? Is it gradual or sudden po?
Gradual po.
Yung muscle pain po, saan particularly masakit?
Sa may bandang joints po.
Okay po. Yung pananakit ng muscle mo po, nag-radiate po ba siya sa ibang part?
Opo, minsan po sa balikat, minsan sa likod.
Pwede niyo po bang i-rate yung sakit from 1 to 10? 1 as the lowest, 10 as the highest po?
5 po.
So yung pagpapawis mo po gabi-gabi nangyayari, parang pattern po siya, right?
Yes po.
Quoting the patient's own words is called chief complaint. In making the patient's report, it is important to quote their statement because sometimes they do not have any specific complaints. Also, the chief complaint helps the nurse to identify the patient's feelings and pain. An example of this, lagi akong pinagpapawisan kapag gabi.
Tinry niyo na po bang i-treat yung nararamdaman niyo pong symptoms like pagbili po ng gamot sa pharmacy without prescriptions?
Hindi po, ma'am. Akala ko po kasi simpleng pananakit lang ng katawan ko.
Okay po, ma'am. Ngayon naman po, tatanungin ko po kayo about sa past niyo. Meron po ba kayong allergies?
Wala po, ma'am.
May tinitake po ba kayong gamot?
Wala rin po.
Nagkaroon na po ba kayo ng childhood illnesses like measles, mumps, chickenpox, or polio po?
Nagkaroon na po ako ng chickenpox nung bata pa ako.
Okay, kompleto naman po ba yung immunization niyo?
Yes po.
Umiinom po ba kayong alak, ma'am?
Hindi po.
Okay po.
Taking a history is an important procedure in interviewing the patient. This history taking gives the nurse and doctor information that will help the patient's medical issues that may be related to her present symptoms.
Family niyo po ba may mga sakit like diabetes or hypertension na pwede po maging cause ng kamatayan niya?
Yung tatay ko lang po meron siyang diabetes. Pero buhay pa po siya ngayon.
Okay po, noted.
Family history is a record of the diseases and health conditions in your family. You and your family members share genes. You may also have behaviors in common such as exercise habits and what you like to
Alam
eat.
niyo po ba yung usual weight niya, ma'am?
Hindi po, ma'am eh. Pero sabi po ng pamilya ko, pumapayat raw po ako at hindi raw po sa akin ng bagay ang mapayat.
Ma'am, kamusta naman po yung ibang part ng katawan niyo po? May pamamaga po ba?
Meron po, ma'am. Dito po sa may bandang leeg ko, meron pong namamaga.
Meron din po puti-puti yung dila niya, no, ma'am? Rashes po, baka meron po kayo?
Meron po ako dito sa may bandang dibdib. Pwede rin po dito sa may likod ko, ma'am.
Ma'am, regular naman po ba yung menstruation niyo? Meron po ba kayo nararamdaman na kakaiba sa ari niyo?
Yung mens ko po, ma'am, parang nawawala po siya sa track. Matagal po siya bago dumating ulit. Tapos parati pong masakit at makati yung ari ko po at nagkakaroon po ako ng discharge na parang cheese po.
Ngayon, ma'am, tatanungin ko naman po kayo about sa daily life niyo po. Yung socialization niyo po, yung mga routines niyo po, okay lang po ba?
Opo.
Okay po. How will the friend describe you po?
My friend described me po as a cheerful person.
If you can change anything about yourself, what would you change po?
I think wala po akong papalitan sa sarili ko kasi tanggap ko po yung sarili ko.
Have you experienced any change in your activities due to your symptoms po?
Yes po, nababawasan na po yung mga exercises ko at matapos lang po yung routine activities ko, nagpapahinga na po ako.
So health patterns provide nurses information about the personal social history of the patient, their daily living routines that may affect or influence their health and illness. And for example, these are their self-perception, belief, sleep patterns, or their daily diet.
To assess your risk for various diseases, I need to ask you some questions about your sexual health and practices. Is that okay po?
Yes po.
When was the last time you had an intimate physical contact with someone? Did that contact to actual sexual intercourse po ba?
Kanina lang po bago po ako pumunta dito, nagkaroon po kami ng intercourse ng boyfriend ko.
Do you have sex with men, women, or both?
Sa lalaki lang po.
How many sexual patterns have you had in the last 6 months, in the last 5 years, in your lifetime? How often do you use condoms po?
Every month po siguro nagkakaroon kami ng intercourse ng boyfriend ko. And kadalasan po hindi siya gumagamit ng condom. And nagwi-withdrawal method lang po siya.
Do you have any concerns in HIV infection or AIDS?
Actually po, my partner has been with several connection po with other women bago po ako. Kaya medyo na-worried po ako, lalo na sa health naming when it comes to HIV and AIDS po. May mga symptoms and signs rin po na meron siya at meron rin po ako.
Thank you for that, ma'am. Now let's proceed po sa mental health. Have you ever had any problems in mental or emotional illness?
Wala naman po.
Have you ever visited a counselor or psychotherapist po?
Hindi pa po, ma'am.
Have you or has anyone in your family ever been hospitalized for an emotional or mental health problems?
Wala pa naman po.
Over the past 2 weeks po, have you felt down, depressed, or hopeless?
Sa totoo lang po, medyo nalulungkot at frustrated po ako since last week dahil sa nararamdaman ko po, lalo pong nadadagdagan dahil sa nangyari sa amin ng boyfriend ko ngayon.
Have you ever thought po about hurting yourself or ending your life po?
Hindi naman po.
Are there times in your relationship that you feel unsafe or afraid po?
Yes po.
Within the last year, have you been hit, kicked, punched, or hurt by someone you know po? If so, by whom po?
Opo, yung boyfriend ko po. Napapadalas po yung sexual assault niya sa akin. Kapag hindi ko po siya sinusunod, sinasaktan niya po ako.
Okay, I believe that's it po. Thank you po for your cooperation, Ma'am Cheryl. I am hoping for your fast recovery and I will update po when the results are ready.
Thank you din po.
Kapag katapos ng assessment, doctor's examination at nalababasan lab test results, ang patient ay na-diagnose at mayroong HIV. Habang ina-assess ng nurse ang pasyente, karamihan sa sintomas ng HIV ay nabanggit. Ang virus ay nakuha niya mula sa kanyang nobyo dahil sa sexual assault at pakikipagtalik ng halos every month. Ayon sa naging salaysay ng pasyente, marami itong napagtaan ng pakikipagtalik hanggang sa maipasa niya ito sa pasyente natin ngayon. According to Mayo Clinic, HIV is a sexually transmitted infection or STI. It can also be spread by contact with infected blood and from illicit injection drug use or sharing needles. It can also be spread from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS.